So when it comes time to delivering biomarkers, in particular next-generation sequencing-based biomarkers for cancer care, there's an immense need for speed. And this is perceived from patients, from oncologists. And in order for us to understand that from within the laboratory, we really need to understand what's going on with our patients and a little bit about these diseases. Lung cancer, I think, provides the best example of why these results need to happen very fast. In Canada, about 50% of lung cancer patients will present at an advanced stage, at stage 4, requiring a systemic therapy. These patients are very sick, and they tend to present in extremis, requiring treatment right away. In fact, we know that the death rate of advanced non-small cell lung carcinoma prior to treatment is about 4% per week. Also, in a publicly funded healthcare system like in Canada, it costs us about $400 a week or more to provide supportive care to these patients in the period in between their diagnosis and when they first receive therapy. So it is paramount that we get these results quickly, as without a complete set of biomarker results, it is impossible for an oncologist to decide on the most appropriate treatment for a lung cancer patient. I practice in a community hospital, which is where the majority of cancer patients are diagnosed and treated in Canada and in many similar jurisdictions around the world. Traditionally, we send our biomarkers out to another academic hospital, and using that route, it takes 6 to 8 weeks to receive results. When we insourced biomarker testing using a rapid method, the turnaround time went from 64 days on average to 3 days on average. The difference was immense. This meant that the majority of cancer patients were going to have their results available at the time when they first met with their medical oncologist. So that means when they had that first encounter, the oncologist could make a critical decision as to if this patient was going to receive a targeted therapy and what that appropriate targeted therapy would be, or if they were going to receive chemotherapy or immunotherapy. And without that information present at that first oncology visit, the visit becomes a waste. It becomes impossible to start the patient on any form of treatment.